Welcome to the Breathwork Summit, a free online event where you'll learn from top experts about integrating the power of your breath to transform your health and well-being. Share this powerful program with your friends and family, and come join us on Facebook at The Shift Network. And now your host, Jessica Dibb.
Welcome to the Breathwork Summit. This session is called Breathwork in Cancer: Resilience, Symptom Reduction, and Support of the Immune System. And our faculty is Alicia. Alicia is a psychotherapist, clinical psychologist, breath worker, and researcher with over 20 years of experience of helping cancer and medical health patients in clinical settings using various forms of breath work and body work. Alicia, I am honored for you to be with us here today.
Thank you so much for inviting me. I am very happy to be with you and to share.
Well, this is going to be a really important session because we know that over the last few decades, there has been a proliferation of cancer due to many factors, not really primarily genetic, but more having to do with environmental and stress and all of that. So there's almost no one who isn't touched by cancer, either in themselves or a friend or a loved one or someone else that they know. And the healing of cancer is a really cutting edge issue of our time. And I want everyone to know that I first met Alicia when I put together a conference at Omega Center for Holistic Studies called Breathwork Immersion: From the Science to the Samadhi. And Alicia was electrifying for everybody there because she'd had the courage to bring this modality of breath work into the community with cancer patients, and not only do very deep work with them that she was showing us had profound emotional impact and also physical impact, but also to gather research. So she's been one of the very first people that has been consistently doing breathwork research. So let's find out a little bit, Alicia, about what set you on this path. First of all, how did you come to breathwork? And could you share with us something about your early experiences with breathwork that was powerful to you and made you want to keep exploring it?
Yes, of course. When I was 16, I realized that I really need something to feel better and to find my way into life. I was a very stressed individual, and I bumped into the book of Sondra Ray about loving relationships. You should know, during these years, it was 1990 in Poland. Communism has just ended, and we didn't have a large variety of trainings and books. So it was a great insight. And later I met a book by Lowen about bioenergetics. And I decided that I really need to start breath work, and I really have to do some kind of yoga or to deepen my insight with breathing. And I found first Rebirthing Circle, an official group of people who were taught primarily by Leonard Orr and later by Robin Lowry. So they showed me how to breathe, how to have conscious breathing sessions. And I really had a great breakthrough at the third session when suddenly I felt my muscle blocks are just melting, and I am feeling who am I, what I am capable of, and all my depression and my anxiety, they were just smaller and smaller. So after 3 sessions of breath work, I was a completely new person heading to life. And I decided to become a body worker and breath worker at such a young age. So it was such a long journey. I have become a breath worker before I became a psychologist or a psychotherapist.
Thank you for that story, Alicia, and also just really your exploratory spirit. So it's interesting that you went into this holistic health modality and then you decided to become a psychotherapist. Can you tell us what motivated you to do that?
Of course. I am a little crazy scientist since the beginning. I was born like that. And I have millions of questions about breathwork. Why it is working? Why several friends from breathwork area are still alive despite really grave diseases? How could we implement breathwork to help larger population? And my friends from holistic health area, they couldn't answer me these questions. I could receive an answer, oh, you are too intellectual. And later on, Poland is a very conservative country with a strong Catholic streak. So breath workers received a lot of hate and stalking at that time. And I decided to deepen my knowledge officially at the university. That is why I decided to study psychology. And later, I continued studying psychotherapy during all these years. I wanted to bring breathwork into official mainstream because it was so effective, so deep. And I was curious how could it enhance the psychotherapy process. And in my opinion, it really helps going very deep and to release blockages and traumas that are lying buried. Verbal therapy is not so effective. So I am a scientist from the beginning, so I just wanted to get a bigger picture. And that's how it ended at a radiotherapy clinic where I have been working for the last 20 years.
Wonderful. So you mentioned a very fascinating fact that you were noticing that there were people doing breath work who were alive and healthy even though they had had very grave diagnoses. So you were actually seeing those kind of people in your community, in your breathwork community?
Yes, and we are talking. How are you doing? How could you cope with this difficult cancer? How could you cope with your brain disease or your skin disease? So it was so fascinating to see them feeling better or living very long despite prognosis. So it was so enriching and inspiring. And I was always very aware of life, that life is short, that we can contract various diseases, we can be ill, and I really wanted to have a great remedy.
With the use of breathwork, Alicia, with people with cancer, and then of course people with any kind of severe health challenge, that there are 3 levels of things that can be affected by breathwork that you could speak to. One is how it is that that person could feel relief from anxiety about their illness, how they could feel present, how they could feel peaceful. The second one is about side effects. Particularly with cancer, if people elect to go with chemotherapy or something like that, there can be a lot of side effects, as we know, of nausea and, panic, and also like even anemia in the blood and weakness and fatigue. And then the third thing is, so there's the emotional component, and then there's dealing with the side effects. But then there's a third thing about what kind of impact you're seeing with breath work with people having better outcomes in terms of their physical illness, recovering from it, living cancer-free and that kind of thing. So that's a lot to talk about. But if you could say a little bit about each of those and some of the research that you've conducted, that would be beautiful.
Of course, with pleasure. My first study was about emotional states, about relieving stress, anxiety, and depression. And I was so happy that 10 classical breathwork sessions gave a big release to a group of healthy people. And afterwards, my patients who trusted me, who developed therapeutic relationship with me, they had enough trust to start breathing with me. And I saw trauma releasing. I saw that they were better and better, and their physical state improved. And it was also connected with significant dreams, which mainstream psychotherapists would interpret as healing dreams, dreams of getting better. After several years at the cancer clinic, I decided to study connection between breathwork and immunity. I realized that there is a very small research on immunity and breathwork, and this research showed that breathing may enhance activity of natural killer cells. These are cells which are mainly killing cancer cells. Very smart lymphocytes which are tracing cancer cells. So pranayamas are known of their benefits. And this research made me decide to start my own. A group of breast cancer patients agreed to take part in my study. One group had verbal therapy and relaxation sessions. The other group had breathwork sessions, and we worked every day. After radiotherapy, it is about 5-6 weeks, and also after our training, it appeared that breathwork group had higher counts of natural killer cells. And I guided analysis that showed that breathwork group had increase of natural killer cells counts in 72% of cases. And control group, it was only 32% of cases. And that increase of natural killer cells in my breathwork group was sometimes higher than at the beginning of the treatment. I studied the changes in blood during the breathwork session. And during the classic conscious connected breathing session, after 30 minutes, stress hormone called cortisol started to it was getting low, and the prolactin hormone rose significantly. Prolactin stimulates natural killer cells to kill cancer cells. Cortisol diminishes activity of natural killer cells. So I realized that breathwork session is helping our body to cope with a cancer. And it was visible after 30 minutes of breathwork session. It was the 10th session, the last session of our intensive training. So our patients were able to breathe really fully and without any resistance. So my research showed that breathwork practice may help increase the count of natural killer cells, and it depends on the blood pH during the breathwork session. The higher blood pH is during breathwork session, the bigger is the natural killer cells count. So that was really surprising how rhythmic, continuous, circular breathing could help to regenerate and to cope with cancer. Whole study was quite complicated, but this is the most important result of all. Of course, my patients from both groups had lower anxiety. Breathwork group has significantly lower aggression level comparing to the controls. They had better positive re-evaluation of their disease, so they gained some insight during our therapy. So results were beneficial both in emotional area and physical area. I could not provide analysis of survival because almost all patients are still alive. About 3 patients from each of the groups has died from various reasons, and it is too little to provide analysis of survival. So all patients are doing very well. And also I found that the patients who rejected my invitation to take part in therapy, both relaxation or breathwork, these patients had a lot of incidents of recurrence, and many of them has died. So that shows that they were in a very bad psychosomatic state when I asked them to take part in the study. Something in them was already very, very ill. Maybe, Jessica, you could ask me a couple of questions, because, I am a crazy scientist and I talk too much.
Oh, no, I think we could listen to you talking for quite some while. This is pioneering territory, and it's so critical, as I said, because we know so many people. The estimate now is that 1 out of every 3 or 1 out of every 2 people will have some form of cancer in their lifetime. And, cancer just psychologically, my own sense of it and many others is that it's like this part of the body or the immune system has become like a gang of, out of control adolescents who are not loving themselves anymore, are not loving the host. And it's crazy. It's suicidal. It's like it actually, they kill the very thing that's keeping it alive. And so it seems very analogous or metaphoric for a lot of things that ail our planet. And as you talk, I feel that thread of the incredible resonance of the psychodynamic experience of the person and their body. And of course, what we can't even measure completely yet is the way that they're being impacted by their culture, by the world and what we're going through. It may be that some people are more sensitive to those energies and their bodies are more impacted. And you're saying things that, you're saying them with great calm, but they're incredible, seemingly miraculous. You're talking about everybody's, still alive, and you notice that people who were resistant had recurrence, many of them died. So we're talking about breath work, both in terms of oxygen. We know that in the presence of oxygen, bacteria, viruses, cancer cells cannot live. And you're also talking about it from a psychodynamic level, that as people unwind from their trauma, their body seems to be able to meet this shadow in a way, this sort of gang of self-destruction that's happening through the cancer in a different way that allows them to get well again. I mean, I have to ask you with all of that, because just for me listening, were you just like so excited with the results? I mean, just, it seems like a life-changing results to find.
These results are really surprising, and I'm happy to see it. And it is also complicated. Now I am in a process of publishing full text containing all this data. I have forgotten to add that oxygenation of breathwork group, of course, improved over time, contrary to the controls. And what does it mean to the cancer cell? Cancer tumor is not having enough oxygen and is half dead as a zombie. And these half-dead cells, which are not nicely oxygenated, they are very resistant to cancer treatment, especially to radiotherapy. I always tell all these things to my patients every day. You need to oxygenate your tumor because it will be nicely killed by radiotherapy. So this breathwork practice may help not only to increase your natural killer cell counts, but also it may improve the results of typical cancer treatment. So I think it is pretty important to breathe, to get a bit, alkaline several times a day. I ask my patients, please breathe in a circular way several times a day for 5 minutes, 10 minutes, just to feel this sensation of being a little dizzy or meditative or calm or passionately agitated, but just breathe and feel your breath work to oxygenate your body and to activate your immune system. So I believe it works in two ways. It also needs a lot of more research than my small research on 80 patients. But still, people should know this, that even 5 minutes of breath work every 2 hours, let's say, might change the result of the treatment. It might really help. Of course, if they are not smoking.
Good point. Alicia, you're saying something that is so important for breath work to be accepted in our world and utilized for illness, physical illness, emotional regulation, also spiritual development, which is, some people think that because we do this deep connected breathing and we might start to feel a little dizzy or a little buzzy or, people describe it in different ways. If you go down the straight medical sort of vernacular, you have this fear that, you're producing a state of hyperventilation and it's not healthy. But you're saying that actually these people that did better and have survived their cancer, you actually think that state is part of what helps that happen. Can you say more about that? That's revolutionary.
That's wonderful for them to breathe deeply. And when they feel tingling or a bit of dizziness due to over breathing, I tell them it's a little too little of carbon dioxide in your blood, but this is not a problem. Your body needs to get over it. Just breathe and feel and get alkaline. Well, my study group, my research group, they had 10 long, deep, conscious connected breathing sessions every 2 days. And they had short sessions every day, 15 minutes. I asked them to breathe by themselves, 15 minutes a day if they are not working with me. And 10th long session, when I studied the blood pH and carbon dioxide. I compared the beginning of the session and 30 minutes of breathwork session. So group who had higher blood pH, they had a larger population of natural killer cells after the treatment. The difference between control and research group was visible after 8 weeks at home, because radiotherapy is killing white cells in general. So my patients needed to regenerate, and the last measurement of increased natural killer cells counts depended on the blood pH during a deep breathwork session at the end. So a 10th session, it was the session when they were breathing fully. And the higher blood pH was, the better result they had at the end of my study. So getting a bit hyperventilated, I don't think it is a problem. Psychologists were scared for years. Oh, hyperventilation is so bad. People are panicking. It's so bad for you. It's not bad. It's just the body who is not adjusted to a lower level of carbon dioxide. And the second important information I have gained from this study was that I had only women in the same medical situation, and ladies were having a very low blood oxygenation in general, above normal. Nobody had normal blood oxygenation. Women are breathing terribly, ineffectively. And that was a shock. And after my training, after 8 weeks at home, they had better partial, I forgot this word. Blood oxygenation was better after 8 weeks comparing to the controls, but it was still above normal. So partial oxygen pressure of blood was higher in breathwork group, but still above normal. And it does not happen in case of men who are breathing with me. Men are more effective in breathing.
That is a very powerful finding. And I'm wondering if you can say more about your instinct about why that would be, why men would be breathing more efficiently. What do you think? Do you think this is psychological? Do you think it's a physiological phenomenon?
I believe that it depends on education and the culture that tells women to be calm, be still, not to overreact, not to laugh loud. It's all, I believe it's all dark heritage of old patriarchic times. Maybe it's not the past yet. We are, as a women, we are not wearing these uncomfortable dresses as we were used to in 19th century, but still this education about being still, behaving well, not talking too much, not expressing yourself, being too polite. I think it is all a heritage of this kind of upbringing.
Clear. You're saying that this would be true, you found this to be true of any woman, not just women with cancer. Is that correct?
Yes. Yes.
Wow.
I believe this bad oxygenation is also the part of physiology of modern women now, in general.
Mm-hmm. Wow. So, Alicia, first of all, people are you're publishing, or you're saying that you're going to publish some of this. And I'm sure there are some people that would love to be able to get a hold of the research so that maybe they could take a program into their hospital or their clinical setting, their psychology practice. Could you tell people how they could get a hold of you or get a hold of the research?
Now, large summary of my research with all statistics is on my ResearchGate profile. And I will present all this research and also my new paper on dealing with claustrophobia and helping to heal claustrophobia quickly with breathwork during the large Congress of Society for Psychotherapy Research in June in Amherst, Massachusetts. So I am available at the ResearchGate, and I can be contacted by Facebook, and also I will be in the USA presenting all these materials in June. And I invite everyone to contact me. Writing a large paper in an unknown area is a challenging thing, so I'm trying to do my best now.
Well, I'm very grateful for your best. I'm including some of your research in the book that I'm writing about integrating breathwork into psychotherapy. And, this is just groundbreaking work. I wanted to circle back and just for people who are hearing some of these terms for the first time, that when you say the pH is higher when the person does conscious connecting breathing, you're meaning that it's moving into a more alkaline state.
Yes. Okay. Yes, of course.
Yes. So, Alicia, maybe you might have a story or two, maybe just even one story of a particular person with cancer that you worked with where you just saw the results were very, very clear psychologically and physically?
Of course. I have a lot of patients who spend a lot of time with me breathing and experiencing their true self. I still remember my patient. She had a recurrent breast cancer, and it was a bad cancer with a bad prognosis. And she had to terminate pregnancy to get the treatment. So she was so devastated and depressed and panicked that she didn't even complete the treatment. She got back home and she spent 2 years panicking, crying, and drinking alcohol. And we met after 2 years when the cancer returned. She was admitted to our clinic, completely depressed and traumatized. And I held her hand, and she started breathing consciously, deeply, and very fully without an instruction. Her body somehow felt that finally her body can release all this trauma and pain. And after 3 sessions, she stopped having panic attacks, and she also had agoraphobia after this horrible event of pregnancy termination. After 8 sessions, she stopped taking medication for agoraphobia and depression. And she is cured completely. She adopted 2 children, and she lives happily despite primarily bad prognosis and a very poor mental health state. And it was 19 years ago, and she's still now healthy and happy.
This is astounding work, Alicia, and on top of the power of the breath, I just really want to honor you for developing yourself enough that you are available to be present for people in this way. And a lot of the stories that you tell talk about people who use the breath work while they are also doing treatment, allopathic treatment, radiology, I assume chemotherapy, different things for the cancer. Now, that's amazing because there's usually a lot of side effects from those treatments. And so we might want to say something about, did the breath work show visible reduction in side effects for cancer treatments?
Of course. My first thought was about nausea. My patients who are taking chemotherapy, they are nauseous and they are taking medication, but still they feel very bad and dizzy. And my usual practice is quite simple. You need to take a bottle of warm water, or a cat, if you have a cat nearby, put it on your belly, and you need to slow down your breathing and to feel your diaphragm and feel the bottle of warm water or your cat, and feel the warm and breathe into it. And this regulates the overreacting vagus nerve. Just calming down and slowing the breathing with this warm place on the patient's belly, and it usually really helps. Sometimes, if the sensation is really strong, I ask my patients to move the bottle with warm water between their ankles to move the consciousness down low, to focus on their feet, to ground themselves even if they are lying down, and then to breathe slowly and to feel the warmth and relaxation during the slow breathing. And they breathe as they feel it is comfortable for them. I don't need to count breaths per minute in this case. It is very simple but very effective. I was thinking also about radiotherapy. Radiotherapy might be very painful, especially in head and neck area. So any kind of rhythmic breathing may help release endorphins. So I cooperate with my patients who are undergoing very long treatments, radiation treatments, taking even 6 weeks. And every day they are breathing and they are getting better, and their pain is not so deep. Of course, my patients are receiving medication for their pain, but pain caused by radiotherapy and discomfort is very difficult to bear. And breath work and concentration on breathing when someone is suffering, it helps to let go. It helps to not to fight with the pain. And this single intention of not fighting, of letting go, may release, as mindfulness research says, about 40% of the pain, even if the pain is chronic. So simple intention of breathing slowly and letting go, accepting the things that are going on in the patient's body, it is 30% less of the suffering. These are the two main exercises my patients are using without pressure and without the duty of being relaxed. They don't have to obey anything, just to accept what is happening without fighting, just with positive intention on breathing, of being aware of experiencing also nice things in their body. After several minutes of breathing, endorphins will start working. So this is my everyday work.
And I think that we want to get to one of those practices that has to do with the stimulation of endorphins. And before we do, I want to ask you 3 very quick questions. Try to get these in because there's just so many questions that I'm sure people have. So one is just very succinctly, you are saying that these results happened with people just doing 10 sessions of conscious connected breathing. You're not talking about doing years.
No.
Is that correct?
If you are asking about these immunity results, my patients had 10 sessions with me, 10 long sessions, and a lot of 15 minutes short sessions. And my patients continued to have 1 long session a week. And it was 8 weeks after treatment when we had the last control measurement. So if you refer to this, if you refer to nausea, my patients are benefiting very quickly from this exercise. Sometimes I have 20 minutes for each patient, so I really must be effective, and I adjust to the patient. So the breathing might be slow, might be fast and intensive. It depends on the patient's process, but in general, when the patient is alone and there is no breath work inside, intention of letting go and accepting what is going on in your body, connected with deeper, slow breathing, it will help a lot. Yes.
So you would do 10 concentrated sessions with them yourself, and they would do 15 minutes or 5 minutes on their own every day. And then they would do weekly sessions following up through 8 weeks after their treatment.
Yes, and I started my research in the year 2006, so it was several years ago. And now I have adapted to my patients. So I am working with my patients every day if they are available. So they even have 5 sessions a week with me during radiation treatment. And when they are alone, they are breathing 15 minutes a day, 2 times 15 minutes a day, 4 times 5 minutes a day. They adapt to the conditions, to hospital conditions, to how they are feeling. So my study was very methodologically, we had to follow certain protocol. But now I just need to teach my patients how to breathe in a conscious, connected way, how to breathe fully, and later on they can do it by themselves every day to get a bit alkalized and relaxed and to connect to their true self. Maybe that's not a scientific statement, but I believe that conscious breathing helps us to express ourselves emotionally, to release trauma of everyday life and old traumas also.
Thank you for sharing that protocol. And I also want to just thank you for the explanation for people about not being afraid of that state with the little bit of tingling and all of that, that is the alkaline state. You know, breath workers instinctively say that we just need to breathe through that. And you're saying that you have actually been able to show the science that if a person can allow themselves to breathe through that alkaline state, their body develops an ability to not need as much carbon dioxide in order to breathe, and they become healthier in general. That's an amazing finding. Thank you so much for that, Alicia. And the third thing I just quickly want to say is, so all of these people you've described are people that were doing conventional cancer treatment. Have you worked with anybody who decided to just do breathing and mindfulness and meditation and other kinds of perhaps alternative therapies without cancer treatment, conventional cancer treatment?
Never. Never. I have never agreed to guide a patient who refused an allopathic treatment at all. It is a complicated situation. Sometimes when a patient is deciding to quit traditional treatment, later on, when this patient dies, family is very sad and furious at the same time. And as a psychotherapist, I would never cross that line. And I read a lot of research on cancer. Cancer is a complicated disease, and there are thousands of cancer types, different genetic types. There are thousands of treatment protocols. Somehow, personally, I don't believe that cancer could be cured forever with breathwork and mindfulness. I admit it.
And what I'm struck by is how the combination of the treatment and breath work seems to elevate, as you said. For instance, it makes the cancer more available for the treatment. And so there's a way that the breath work elevates the traditional treatment to be less toxic to the body and more efficient. And so it seems like it's quite an incredible partnership.
Yes, I believe it.
So, Alicia, we just have a few minutes, and you spoke to me before we began this session about a breath technique that you do with people to stimulate endorphin release, and that you do with your patients. And we would be just so thrilled if you would guide us through that.
Thank you. So I would like you to focus on the middle of your head. In the middle of your head, not your brain, in the middle of your head, there is a place called periaqueductal gray. It is a very official name for the structure that was called a crystal chamber by ancient Chinese Taoists. It was called a proto-self by neuroscientists. That place is responsible for the deep endorphin release, and it's also responsible for conscious breathing, vocalization, and emotional expression in mammals. So this is a place where I would like you to focus and imagine something light or colorful. Just breathe into your head, feel the middle of your head. We might focus, and maybe you could see a fountain of light. And when we are breathing into the fountain of light, maybe it's a rainbow light, or there are bubbles of light, or just a beautiful white light. The fountain is producing a lot of light, and this light is spreading with every breath. It's filling your head, your whole brain. Your mouth, your throat. Just breathe and try to let it go. Let the light and breath fill all your body, especially the place where it hurts. Let us breathe and we can also imagine the second fountain in the belly. Under your navel, you may see the second fountain, which is producing a lot of beautiful light, spreading in your intestines and everywhere else. Two sources of light and bliss. And you may adjust your breathing to the rhythm that fits you. Might be slow and deep, might be shallow and a bit faster, but keep feeling and imagining this fountain light going to every part of your body. It is a great visualization before surgery. And every time something hurts, something is difficult, or you feel emotional pain in your body, you may try to let it go and breathe the light into it, starting from the center of your head and the point under your navel if you wish. Feel free to share. Thank you.
Alicia, you are a treasure.
Oh, thank you.
And breath is a treasure, an immeasurable treasure. And I know that this session will support and serve the treasure that is in all people. Thank you, everyone.
Thank you so much for having me. I am honored and I am happy to share with everyone in need. Thank you so much.
Thank you for joining the Breathwork Summit, brought to you by the Shift Network. To learn more, visit breathworksummit.com. To learn more about our global programs to support you in waking up in all the areas of your life and taking inspired action, visit theshiftnetwork.com. Thank you again for joining us and for sharing this empowering path to embracing optimal well-being through conscious breathing.